If we look at the mental health system in New South Wales, there are a lot of different funding bodies, there's going to be a lot of different programs, and there's not one consistent level of service offering in any particular area, and that's why it gets very confusing for people to understand where to refer. Firstly, if we look at government agencies and bodies that fund programs, the New South Wales Ministry of Health, the Department of Communities and Justice, and nationally, the Department of Health, and they fund what are called primary health networks to then commission or find service providers in the local area to meet the local need. Non-government organisations or community organisations are funded to then deliver those services locally. We have what we call programs that are funded to provide early intervention. That's actually supporting people before their distress becomes very acute to the point where they might need a more intensive support, right through to traditional emergency departments and inpatient units. One of the things around the emergency department system is they're not typically geared to mental health distress. We're starting to see a little trend where more mental health specific emergency departments are starting to pop up around the country. There are models of care which are progressing these days called step up, step down services. What they offer is an option for people that are starting to recognise that they're needing more support, but they're not at that level of needing to go to hospital, to help them stabilise and get back on track and then be able to move back into community. One of the challenges with referring to the existing service system is that many programs have eligibility criteria. The federal government, through the Department of Health, have now started funding what is called the Head to Health services. There's actually very little, if any, eligibility criteria around these programs. They are funded well. They're funded to operate 7 days a week. They're funded to be able to have a door open there you can walk in without a referral. And they're funded to be able to provide a range of different supports then and there for an individual. Would highly recommend promoting that within your services to your tenants. What the best approach is for housing workers is to really engage with your local community where you're delivering supports. Understand, one, what programs are operating right now, two, which programs have space, and three, how to then actually refer into those programs. Really strongly encourage people to, at least someone in the team, to be involved in engaging with your local interagencies. Even though services may not have capacity at times, if you can build strong relationships between your organisation and those organisations, sometimes you can have workarounds to actually allow access into those programs because people understand what you do, how that tenant is going to be supported by you and your organisation better. Telling that story will go a long way to making sure that people then will start accepting more of your tenants. Whilst navigating the system is complex, it's really important to remember why we do that. All too often, people in public housing or social housing, in community housing, mental distress kicks in when it's not understood, when the context isn't understood. Things can spiral out of control quickly and the person can find themselves evicted. Understanding your system, understanding what works, understanding mental distress and the complexity around that and the context to that will help you be a better housing worker. It will help you connect better with your tenants, and it will help your tenants maintaining their tenancy and not becoming evicted.